Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. In the last previous class of the Sindur selection series, we have discussed a lot of the important questions, concept with a clear rationale without wasting a single minute of the time. So, same here in the today's session also, we are going to discuss those very important high yield and very important questions. Questions with a new pattern, questions which requires somewhat time with the tricks. We will discuss, we will learn the technique how to solve the MCQ also here. So please do watch the video till the end of the session. Good evening, beta. Very, very good evening to everyone. So everyone, please share the class to your WhatsApp status. So the aspirants who are searching for a good content can get benefit of this one, right? So while watching the class first time, so please hit the like button along with that, so click on the subscribe button also, so whatever the videos we are posting on the daily basis will reaches you first, right? So hope every one of you enjoyed the x-ray class where I have taught you all important signs of the x-ray. Okay, then in middle I have taught how to interpret the chest x-ray with a very basic concept. Then I have discussed the most important questions on the interpretation of the chest x-ray, very easy manner, right? So the class which is available free in the YouTube also, so you can get utilize of that one. Okay, because the important questions striking we know from here, so we are discussing those concept and questions. Okay, so don't miss the single class as well. So every day you have to attempt a class. So that is most important to you people. Okay, the consistency is the key for the success, right? So good evening, beta. Very good evening. Hope everyone joined to the class. So we'll start the class now. So we will begin a class with this particular motivational quote here. The comeback is always greater than the setback. Bacho, if one result is coming and decreasing your motivation, decreasing your discipline, so you are not made for that one. If you want to quit, so just remember why you have started that one. You have must and should you have to have a never give up attitude in your mind, and a bounce back step you have to take, a risky steps you have to take some time to achieve the great things, right? So the great thing takes some more time. The requirement of the quality content is there, so we are providing that one. Okay, don't have to worry about that one. Your consistency, your discipline matters a lot, right? So yes, bacho, always have a never give up attitude and always ready to write the comeback stories, so then only some people will remember you, right? So we'll start with this beautiful motivational quote here. The first question, the important and new question for you all. So the question is on the Cotard's delusion. Okay, the question is on the Cotard's delusion. A very simple question. So please read the question completely till the end. Then try to choose the correct answer for this one. Okay. So let me read the question. The question is very simple. Which of the following best describes the Cotard's delusion? Okay. First, I will tell what is delusion. What is delusion? Delusion is a psychiatric simple word, a basic word. It means a false, a fixed belief in the mind which is unshakable by the external stimuli. Okay, so the patient is having a false or fixed belief in his mind. Okay, that is what we call it in the delusion. Okay, so yes, so option A is telling that. Now the question is in the types of the delusion, where there is one more delusion, there is the Cotard's delusion. So in this one, option A is telling that a belief that one is being watched or persecuted by the external forces. Okay, so false fixed belief of being watched continuously, okay, or persecuted by the external forces. Here the patient is always persecuting, doubting on other. Okay, so what is the persecution meaning here? So we are doubting on other, where the person is having false fixed belief of doubtfulness on the other, always, always, always. So we call this one as in the a delusion of the persecution. Sorry. right? So what we call this one as in the a delusion of the persecution. So it's not a Cotard's delusion. I am eliminating the option A here. Okay, so then I will comes to the option D, a disorder characterized by a constant feeling of the guilt for something. So patient is having a constantly feeling of the guilt on the of something or some work or the daily routines. Constantly the patient is feeling the guilt. So this is what we call it the delusion of the guilt. Okay, this is also not our answer. Then comes to the option C, a condition in which a person believes that a different people are a single member. So this is what we call as in the yes a Fragoli syndrome. What we call this one as in the Fragoli's syndrome. Very, very important thing. What it means, sir? What is the meaning of the Fragoli syndrome, sir? Let me clarify you. Okay. So Fragoli syndrome is a very simple. Here, a patient will tell that there is no any separate members or the persons. Whatever the persons are here, all are single person only. So let me explain with the example. The nurse, the doctor, the cashier, the receptionist which is there in the hospital, these all are not a single separate persons. These all are only a one person. So like this the patient will tell. So this is what we call as in the Fragoli's syndrome. What we call this one as in the Fragoli's syndrome. Hope it is clear to you all. Okay, so the option C is telling a condition in which a person believes that a different people are a single member. Okay, there is no any different people. So all different peoples are a single member. Okay, so then comes to a Cotard's delusion. So what is the meaning of the Cotard's delusion? A delusion belief that one is being dead, does not exist, or has a loss of internal organ or blood. Okay, the patient is tells he is having a false fixed belief that he is already dead and does not exist. He is does not existing on the earth. Okay, so and he is having the false fixed belief that there is no any internal organs are there in the body. Okay, so he is having the false fixed belief that there is absence of the internal organs, and patient is having the false fixed belief that he don't have any blood in the his body. Okay, so these all kind of the symptoms the patient is exhibiting. So that is what you call as the a Cotard's delusion, the most important. Okay, and new question that may strikes in your upcoming exams. It's very important. Consider it. Okay, this is the correct answer. Hope it is clear to you people. A delusion belief that one is dead, does not exist, or has a loss of internal organs or blood. Okay, so this is the correct answer. Hope it is clear to you people. Okay, so then comes to the next very simple and important question. Okay, so read the question carefully till the end. So very nice of you all. Some of you have given the correct answer for new question also. This is a technique of the method of elimination what I have applied in the first question. Okay, so that's very easy, right? Here's the next question. The next question is very simple. Which of the following clinical sign is associated with the hemorrhagic pancreatitis? What is pancreatitis? Simple word. The pancreatitis is an infection and inflammation of the pancreas where the enzymes which are releasing from the pancreas will do the autodigestion of the pancreas. Okay, so this is the pancreas you consider. From here, if the enzymes are releasing means, so those enzymes itself which destroys the pancreas. So we call that one as the autodigestion of the pancreas. Okay, so the pancreas is a highly vascular organ. When there is infection, inflammation, there is chance of the bleeding is also there. Okay, that is what we call as the hemorrhagic pancreatitis. Okay, so when there is pancreatitis, there is chance of the bleeding. If the bleeding is happening in the abdominal cavity, means that blood will go and collect around surround of the abdominal cavity, where we are having a beautiful signs in the pancreatitis. Okay, it's dangerous signs, not beautiful. Okay, so these are called dangerous signs of the pancreatitis. That is the Cullen sign and Gray Turner sign. Okay, so there are two very important sign we are having. One is Cullen sign, another one is the Gray Turner sign. Sir, how to differentiate this one? Okay, it's very simple, bacho. Okay, look at this one. If you are seeing a collected amount of the blood and grayish discoloration around surround of the umbilicus. Okay, so this is the patient umbilicus. Okay, the grayish discoloration happening in around surround of the umbilicus. So this is what you call as in the Cullen sign, most important one. Okay, so when we see the flank region of the patient. Okay, so what is the flank region? The region, okay, which is posterior, okay, which is near to your kidney, that is what you call as in the flank region. Okay, so in the flank region, if you are able to see a gray color, okay, because of the accumulation of the blood beneath that one, so that is what you call as in the gray Turner sign. So these both gray Turner sign and Cullen sign are the classical signs of the hemorrhagic pancreatitis. Okay, so then option D goes to the correct answer here. The both A and B are the correct one. Okay, so then what is about C option? C option is the Trossius sign. Okay, so this Trossius sign is a classical sign seen in the case of the hypocalcemia. What it means, sir? Hypocalcemia here, hypo means a decreased, calcium means the decrease in the blood calcium level. Sir, what is the normal level of the blood calcium? Okay, what is the normal level of the blood calcium? So this is assignment to you people. At the end of the class, you people have to comment what is the normal level of the blood calcium, what is the normal level of the blood sodium, what is normal level of the blood chloride, what is normal level of the blood potassium. Okay, so all electrolytes with its normal range according to the NCLEX book. I want the answer. Okay, not according to you people. According to NCLEX book, I want the answer. So while are remembering the actual standard values, so please put down in the comment box at the end of the class. So I will see at the end of the class, right? So right. So the next very important clinical signs you have to see, that is the Trossius sign and Chvostek sign. So these both are classical sign of the hypocalcemia. Okay. So if the blood calcium level is going less than 9 milligram per deciliter, so at that particular time there is decreased blood calcium level, we can say. So which causes the spasm. Okay, spasm in two situations. Okay, one situation is when we are tying a BP cuff around of our arm, and when we inflate the BP cuff. Okay, however, the BP cuff is inflating, the carpopedal spasm will happens like this. Okay, are you able to see my hand? Okay, this is what you call as in the carpopedal spasm like this. Okay, so many times we have seen the a case of the thyroidectomy. Okay, because of the damage to the parathyroid gland during the thyroidectomy. The parathyroid is the hormone which is responsible for maintaining the blood calcium level. Okay, when we will do the thyroidectomy, it will damage the parathyroid gland also. Okay, when there is damage of the parathyroid gland, that time decreased parathyroid hormone will happen. So if the blood calcium level is regulated by the parathyroid hormone, here there is no parathyroid hormone, means a situation where most importantly hypocalcemia happens because of the lack of the parathyroid hormone, right? So at that particular time, a case of the thyroidectomy, we regularly monitor for the these kind of the two very important sign. One is the Chvostek sign, another is the Trossius sign. We are always keeps on asking every third hourly, fourth hourly to the patient, any perioral numbness is there or not. So hi sir, why we have to ask like this? But if the blood calcium level is decreasing, the hypocalcemia is happening, means it will show the early sign of the hypocalcemia, that is the perioral tingling or the numbness is the most important earliest sign of the hypocalcemia. In clinical situations, you people must and should ask the patient. Okay, so there are mostly two very important scenario the examiner will create in front of you all. One is a case of the thyroidectomy. Okay, there is chance of the hypocalcemia because of damage to the very important parathyroid glands. Okay, so there also you can assess for the these very important Trossius sign, Chvostek sign and Trossius sign, along with the perioral numbness as the earliest sign, plus one more situation where you are giving the repeated blood transfusion. Okay, so there is also highest chance of the hypocalcemia is there. Why? Because in the blood bag we are using a citrate as an anticoagulant to prevent the clotting of the blood inside the bag. Okay, so that particular citrate what we are using, which binds the calcium like this. Okay, and it makes the calcium to inactivate to work. Okay, so there is decreased chance of the decrease of the calcium in the repeated blood transfusion also. So while giving a massive blood transfusion or the repeated blood transfusion, it is must and should to ask the earliest sign of the hypocalcemia to the patient. Okay, so that is most important sign. The earliest one, remember the perioral numbness, and a clinical two very important sign. One is the Trostius sign. When there is inflation of the beefy cup, there is chance of the carpopedal spasm like this. And one more, when you tap on the facial nerve here, there is spasm of the these muscles. Okay, so are people able to see in the images? So this one may come in your exams as a IBQ also, or as a scenario and concept based questions what I have explained to you people on the thyroidectomy plus blood transfusion. Highest chances there. Another situations also there. We will explain in detail, but these are the important concept what I have delivered here. Okay, so hope it is clear. So here we have learned what is the Trostius sign, what is the Chaustick sign, what is the earliest sign of the hypocalcemia, how two scenarios will be produced in front of you people to check the earliest sign of the hypocalcemia. That is the a case of the thyroidectomy plus repeated blood transfusion. And most importantly, we have studied what is pancreatitis and two very important clinical signs of the pancreatitis, that is the Cullen sign and Gray Turner sign. One question, 1,000 of the points. Most important, okay, for your exam. Okay, hope the scenario and concept is clear to you people, right? So here is the next most important questions in front of you people. So please do read the question carefully, completely till the end, and read perfectly, then give the correct answer. Okay, so this is here you have to understand the difference between the two very important easy words which makes you confusion in the exams. Okay, so do read the word. I'm waiting for your answers. So try to give the best answer, whether it may be a correct, whether it may be a wrong. Okay. So if it is correct, be happy. If it is wrong, your master is here. Don't have to fear. Okay. So right. So the question is very simple like this. A 16-year-old girl suddenly collapsed to ground while laughing at a joke. Okay. So what happened here? A 16-year-old girl is there. Okay, she suddenly collapsed to the ground. Okay, when she collapsed at the ground, so she collapsed on the ground while laughing suddenly. Okay, so what happened here? A 16-year girl is there. For her, she suddenly collapsed here because of the loss of the muscle stones. We can say when laughing at the joke. Okay, here is the situation or scenario is creating. There is loss of the muscles. What we can say the tone. Okay, and there is sudden loss of the muscle tone which leads to the sudden weakness of the muscles when she is exposing to the emotion here. Okay, so this is the scenario which is creating. Okay, so then comes, so she is awake and aware during the episode but cannot move the muscles. Okay, she is completely conscious but she is unable to move the muscles because there is a sudden muscle tone loss is there due to the a sudden emotional exposure. Okay, so then comes to after few seconds she is able to stand up, feels normal again. Okay, so what is the most likely cause of her symptoms? The most important one. Okay, the very important one here I will teach you with differentiation. Remember and give the best shot in the exam and proudly say I am a student of the master nursing classes. Yes, who are live to the class, so please do hit the like button. Right, hit the like button now. Yes, we will go for the explanation. Right, here option A is telling the fainting or the syncope. So this fainting or syncope, it will not happen due to the sudden exposure of the emotions. Why the fainting or the syncope happens means which happens due to the peripheral vascular resistance decreases, or we can say the peripheral vasodilation, where there is a pooling of the blood is there in the lower extremities, and due to the suddenly lack of the blood to the brain. Okay, so that is what you call as the fainting or the syncope, where the person suddenly feels blank or there may be a chance of the collapse. Okay, the fainting and syncope not associated with the emotions, that may be a laugh, that may be a cry. Okay, so that is not correct answer, so I am eliminating the option A. Hope what is fainting or syncope you understood, and why it happens you understood. Okay, why it happens means due to the suddenly vasodilation at the periphery, there is a lack of the return of the blood towards the heart. Okay, there is no blood returns to the heart means the heart pumps but the blood will not circulates to the brain, so that then the fainting or the syncope happens here. Okay, so then comes to the next point, that is the seizure. What is the seizure? Seizure is an abnormal electrical activity discharge within the brain. So that is what we call as the seizure. Seizure is the sudden discharge of the abnormal electrical charges in the brain. So that may lead to the alter in the consciousness also. But here the a patient is completely awake, aware, and she's cannot unable to move her muscles. Okay, so the patient is awake and aware means it not be a seizure here. Okay, so seizure is a sudden discharge of the electrical signals within the brain, that is the seizure. So it is not associated with our answer here, so I am eliminating the option B. Then comes to the main important 2 points here, that is the cataplexy and catalepsy. Okay, so look at this particular core concept you have to understand between the cataplexy and catalepsy. Okay, what is the cataplexy? Cataplexy is a sudden brief loss of the muscle tone triggered by a strong emotion. This strong emotion, it may be a sudden laughing, it may be a sudden crying, it may be a sudden listening of the some dangerous news. Okay, so if the muscle tone is suddenly decreased due to the strong emotion exposure, that is what you call as the cataplexy, the most important. Okay, so here the person is fully conscious and he is oriented and he is unable to move the muscles because of the sudden loss of the muscle tone, but he is completely conscious and oriented. Okay, then comes to a trigger point here, that may be a that is emotion, that may be a sudden anger, sudden surprises, sudden laughing, sudden crying. Okay, so suddenly exposure to the emotions which makings the sudden loss of the muscle tone, that's what you call as the cataplexy. Hope the concept is clear. Then comes to the catalepsy. Okay, so in the catalepsy, what happens? It's a trance-like period. Okay, it means it is a short period where a rigid body posture and loss of the voluntary motion will be there due to the tight, or we can say the rigid body posture. Okay, here the cataplexy, there is flaccidity happening. Okay, so here the flaccidity happening, here the spasticity happening. What is the spasticity? What is the flaccidity? Flaccidity means the muscle is weak. The muscle tone is weak. That is what you call as the flaccidity. What is the spasticity? The muscle tone is strong and muscle is contracting very strong. That is what you call as the spasticity, or you can say the spasm. Okay. So in the muscle spasticity, the spasm of the muscles happens. Okay. So the most importantly in the flaccidity, the weakness of the muscles happens. Okay, the cataplexy is the flaccidity and catalepsy is the spasticity. Most important core word you people have to remember. Okay, so here in the catalepsy, the rigid body posture is happening. In the cataplexy, the flaccidity is happening. Okay, but in the during the catalepsy, it may be due to the some neurological or psychiatric conditions. Okay, so that is there may be a chance of the alteration in the level of the consciousness. Okay, and the patient may sometime unresponsiveness here. Okay, so that is the most important difference people have to understand. Okay, so here the question is, a 16-year-old girl collapses due to the sudden exposure to a joke, means sudden exposure to a emotional responses. So our answer is cataplexy, because here due to the sudden emotion, she's mother lost the muscle stone and collapsing, and she is conscious. In the same situation, in the scenario also they are given. Okay, so she collapsed due to the muscle loss tone and due to the emotion, and she is conscious and aware. Okay, so the answer best goes to the our cataplexy. Okay, and regarding the catalepsy, I have discussed everything. Okay, hope it is clear to you people. Remember the difference between these two very important, very basic words. Okay, so the next question is here. Do read the question completely, then give the best answer. I'm waiting for your responses. I think first you people have studied. Okay, that is the focused assessment sonography in trauma. Okay, so first you people have studied. This is the important one, that is E fast. Okay, what is the full form of the E fast? Okay, choose the answer and drop in the comment box. Fadafat, whether it may be wrong or right. Don't have to fear. Your master is here, right? So the next question, fadafat, do comment in the comment box. Right? Very nice of you, beta. So this is the involvement actually I want. Okay, so what is the correct answer? We'll see here. Okay, what is the full form of the E-fast in trauma management? Very, very simple. Whenever there is the trauma or the emergency situations, we will use a ultrasonography technique, that is name is called as the fast. Okay, that one, a fast is applicable for the abdominal cavity and E-fast is applicable for the abdominal cavity plus thoracic cavity both. Okay, so this is the body consider. This is the abdominal cavity. This is the thoracic cavity. In fast, we will focus on the this particular area and we will keep the probes here. In E fast, we will keep the probes here plus here. So means on the thoracic cavity also will keep the probe and in the abdominal cavity also will keep the probe in the E fast. Hope it is clear. So the what is the meaning of the E fast? Option A is telling the extended focused assessment with sonography for the trauma. Yes, it is extended, it is correct. F means focused, it is correct. A means assessment, it is correct. S means sonography, it is also correct. And S3 means trauma. This is also correct. So option A goes to the correct answer. It is not emergency, it is not external, it is not essential. Okay. So I am eliminating the option last B, C, and D. So the correct answer goes to the extended focused assessment with sonography in the trauma. Okay, especially in the E. So in the extended, we will see for the tension, pneumothorax, hemothorax, and all chest related complication when there is in the trauma to the abdomen and chest. Okay, so almost all you people have given the correct answer on the E fast, and the concept on the E fast and fast is clear to you people. I hope so, right? So here is the next question for you people. Okay, so the question, the new pattern question, the aims want you people to get prepared, that is for the a question like assertion and reason. Okay, so again I have come here with a differentiating the two basic and very important terms, that is the Somogyi effect and down phenomena. Both I will discuss in a such a easy way, so you people will never ever forget in your life. Okay, with a practically what to do as a treatment of this one and why it is happening. So what as a nursing officer we have to do for this all Somogyi effect and down phenomena, I will explain here, because these are the very, very important concept repeatedly strikes in the exams, right? So hope the question is understandable for you all. Let me read the question completely. Okay, till that you people also read the question, then choose your best answer in the comment box. Okay, right? Yes, assertion. The word here it is telling a Somogyi effect is best managed by increasing the night-time insulin dose, and reason is telling that the Somogyi effect results from the insufficient insulin at the overnight. Bachcho, let me deal what is actually a Somogyi effect. Then you people will easily choose the correct answer for this question. Okay, so consider a Somogyi effect. Why it happens means when we will give a extra dose or increased dose of insulin at night or bedtime, this insulin will decreases the blood glucose level. Okay, at night 2 to 3 a.m. the blood glucose level will get decreases because of the increased insulin dose. So the blood glucose level is decreasing, means our body will start to compensate and increases the all compensatory hormones, and which leads to the increase fasting blood glucose level, or we can say the morning blood glucose level will increases. Okay, so what happening here bacho, because of the increased dose of the insulin at the bedtime at the 2 to 3 a.m. the blood glucose level is decreasing, and our body started to compensate and increases the all counter regulatory hormones like cortisol, epinephrine, norepinephrine, growth hormones, and these all are makes the glycolysis from the liver. Okay, so the glycogenolysis is happening, means the glycogen will get converted into the glucose and the blood glucose level will increases early in the morning. Okay, so even we are giving the insulin, and that insulin again which is making the blood glucose level to increase. So this is what we call as the Somogyi effect. Sir, what can I do for this one? Okay, bacho, it happening because of the increased dose of the insulin at the bedtime. So reschedule the dose of the insulin, or we can give the night snacks. Advice for the night snacks for the patient. Okay. Plus a very important, decreased dose. Okay, so decrease the dose of the insulin and advice for the night snack. So this night snacks plus the low dose of the insulin, okay, will not causes the hypoglycemia. Okay, or we can say it will not decrease the blood glucose level at the 2 to 3 am. And if there is no decrease in the blood glucose level, means there is no any counter regulatory hormone, or there is no any compensation. So the morning blood glucose level will comes normal. Okay, so this is what we call as the Somogyi effect. Okay, so here assertion is telling the Somogyi effect is best managed by increasing the night dose. No, but so already due to the increased night dose, it happening. So here our treatment is the decrease the night dose. So we can't best manage this one by increasing the night dose. So I'm making this one as on the false. Okay, this is not a true statement, which is false statement, right? So then comes to the reason a Somogyi effect results from the insufficient insulin overnight. No, it is due to the excess insulin overnight it happening. So this is also a false statement. Okay, so hope these both are understood. Okay, so here the R is also false and the A is also false. Okay, search for that option here. Yes, where is that option? Option A, both A and R are true. No, not true. Both A and R are true. No, it's not true. Okay, then option C, A is false but R is true. No, both A and R are false. Okay, so then option D is remaining. Both A and both R are false statement. Hope the effect of the Somogyi in a treatment of the diabetes you people understood. Okay, so then comes to the a differentiation between the Somogyi effect and the down phenomena. Most importantly, I have told you people. So down Somogyi effect due to the nighttime hypoglycemia. Okay, low blood glucose level because of the increased dose what we have given. Okay, so because of the increased dose of the insulin, nighttime hypoglycemia happening. So which is releasing the counter regulatory hormone. Same thing written here. So nighttime hypoglycemia triggers the counter regulatory hormone. Okay, which increases the blood glucose level. Okay, so when you will see the blood glucose level at the 2 to 3 am at the midnight, so there is patient went to the hypoglycemia. Yes, because of the bedtime increased night dose of the insulin at the 2 to 3 am, the patient went for the decreased blood glucose level. That's what we call as the hypoglycemia. Okay, so then a morning fasting blood sugar is very high here. Yes, so because of the release of the counter regulatory hormone, there is morning blood glucose level is high here, right? So we have understood already. And insulin adjustment strategy, what we have to do? Yes, the reduce the nighttime insulin dose and give the bedtime snacks is the most important. Okay, so nursing measurement or medical management we have to manage here. This is the most important. Okay, so then comes to the diagnosis. When we'll check the blood glucose level at the night 2 to 3 am, so it will show the hypoglycemia, and at the morning it will show the very important hyperglycemia. This is what we call the Somogyi effect. Okay, so then comes to the down phenomena. It is opposite of the Somogyi effect. What happens in the down phenomena? Let me explain with a clear picture. Okay, right? So listen here. So in the down phenomena, here it happens due to the low dose. Okay, low dose of insulin. Okay, the Somogyi happening because of the high dose of the insulin. Okay, so we have given the low dose of insulin at bedtime. At the bedtime, we have given the low dose of the insulin. Then it is not causing the any hypoglycemia because we have given the low dose of the insulin. Okay, so we have to give the 16 units. So we have given only 6 units. Means the low dose of the insulin we have given. So it will not cause the hypoglycemia. Okay, it just increases the blood glucose level. Okay, so due to the lack of the insulin dose, so that is what we call as in the down phenomena, and there is a chance of the release of the counter regulatory hormones are there in the early in the morning. Okay, because this growth hormone will release early in the morning, and cortisols it will in the night only, but especially the growth hormone it will release early in the morning, so that increases the blood glucose level. Here due to the low dose of the blood glucose level, so low dose of the insulin where we are facing the high blood glucose level in the morning. So the treatment for this one is the increase the dose of the insulin. Okay, increase the dose of the insulin. Very simple, just the same thing I have written here. Early in the morning there is a rise in the blood glucose level due to the low dose of the insulin at the night. Okay, so the most important, when you check the blood glucose level at the 2 to 3 am, it is normal only, or it may shows the high only. Okay, so morning also high, 2 to 3 am also high. Okay, due to the low dose of the insulin, that is the down phenomena. Okay, or night in the 2 to 3 am very low, morning high due to the high dose of the insulin, that is the Samagi effect. This is the clinical picture the examiner can throw in front of you people to make you a confusion. But you people have to say in front of the computer when you will sit in the exams, alright, here we are the students of the master nursing classes, we know this all the situations well, and we are here to get a good rank, perfect rank to bacho. So these are the clinical based, situation based, scenario based, practical based questions I am making you to practice on the daily basis in my test series. If anyone of you are not a part of our test series, do join that one. Okay, I will explain the plan of the test series. Okay, don't have to worry. Okay, so but why the down phenomenon is happening? Down phenomenon is happening due to the low dose of the insulin, and the treatment for this one is the increase the night dose of the insulin and adjust the the long acting insulin time. That is the most important. Okay, when you will check the blood glucose level at the 2 to 3 am, so it is normal only, or it may shows the high, so that confirms the down phenomenon. Hope these both concepts are very clear to you people. And here is a course for the good rankers. Okay, so that is the Norcet 9 Navagraha test series for the upcoming Norcet 9 bacho. Here you people are practicing the actual questions which will strike in the exams. That is the assertion and reason based questions, match the following questions, starter types questions, a single liner questions, very basic questions, very advanced questions, updated questions. Okay, the questions will not crosses the all the test series. If you are attending on a daily basis live exams, means a single question will not crosses our extension. Okay, because we have planned everything including the trend, update everything in the nursing field. Okay, so please believe on the content what we are giving, revise the content, revise the question, revise the rationale, so that makes you a champion. Okay, so here this plan is a test series plan plus weekly booster class plan. Okay, so here especially we are focusing on the test series, and weekly one booster class it will comes on the difficult topic to make it to people easy. Okay, so here daily live exam will be there in the morning 6 a.m. to the 11 p.m. Okay, and all India rank will display at the 11:30 p.m. at our official Telegram group, WhatsApp channel. Okay, so then the extra practice papers are there on the prelims and mains patterns. Okay, so then a weekly booster class will be released on the Sunday. Then a chat box support 24 hour into 7s, doubt clearing sessions, and validity of the course will be for 7 months, and daily live exams will become till your Norcet 9 mains paper. Okay, if you are enrolling this question paper, so don't need to again enroll for the mains paper. Okay, so one is enough for the everything, right? So hope you people will like this particular course what we have launched, because this is the India's most updated, most beneficial, and most trusted test series platform, that is the master nursing classes platform. Okay, soon we are announcing the theory class as well, so I will update you once we will announce the classes, right? So here is the next question, which is most important question. Okay, so yes, I think some of you people who attended the morning test series, you people have seen this question, right? Very important question. In the column A, the cranial nerves are there, and in the column B, the cranial nerve numbers are there. Just you have to match these followings and choose the correct answer, right? So these kind of the questions you people have faced in your mains exam, I think so, right? So optic nerve is a cranial nerve which is responsible for the vision. Okay, so that is the cranial nerve number. Yes, how many eyes you people are having? Two eyes, right? So this optic nerve is related to the eyes. So this is the cranial nerve number second. Okay, so that is the A is 3 here, right? Then facial number. Okay, so facial nerve, this facial nerve is a cranial nerve number 7, right? So the vagus nerve is the cranial nerve number 10. Then the trigeminal nerve, this is the cranial nerve number 5. Sir, you know the cranial nerves and its number, so you are choosing this one as the very easily. So we don't have the cranial, like we don't know which nerve is which number. So what we can do? Yes, here is the mnemonic. I know how to deal with a particular concept. Okay, so I will teach you. People don't have to worry. So first we will choose the correct answer. Here the A is 3, the B is the B is 2, then a D is 1, the D is 1, and the C is 4. Okay, sir, this one, where is the answer? The A is 3, yes, B is 2, then C is 4, D is 1. Okay, so the option A goes to the correct answer here, and who all have chosen this one as the correct answer, a very very congratulations to you people, you are in the right path. Okay, so who don't know the name of the particular, what we can say, a cranial nerves. So here are the number of the cranial nerves, so I will write a mnemonic. If you are already having the mnemonics for remembering the cranial nerves, don't change your mnemonic. Okay, if someone of you don't know the number and name of the cranial nerves, then practice it. Okay, so the first one is the O 2, touch and feel very good vehicle is Honda. Okay, so this is the mnemonic you people have to remember. O to touch and feel very good vehicle is Honda. Okay, so here the O, that is the first one, is the one nose we are having, that is the olfactory is the first one. Okay, remember, two eyes we are having, optic is the second one, then oculomotor you people have to consider this one as the, remember this one as the third one. Okay, so that is the most important. Then comes to the trochlear. Sir, how to remember this trochlear and trigeminal? Here the O is there, the fourth one also O is there, TRO, here is the TRI people are having. Okay, so the fourth one also here is the O. Okay, don't confuse between the trigeminal and trochlear. Okay, so here is the O, again there is the O. Okay, then comes to the trigeminal is the fifth one, sixth one is the abducens nerve, seventh one is the facial nerve, and eighth one is the vestibulocochlear nerve, ninth one is the glossopharyngeal nerve, 10th one is the yes, vagus nerve. Then comes to the accessory spinal accessory nerves, we can say IS, here is the S, here is cos stands, here is the spinal accessory nerves. Okay, then Honda is the hypoglossal nerves. Okay, so the most important nerves you people have to understand here. Okay, so that is cranial nerves and its numbers with the mnemonic I thought to you people. Okay, hope you enjoyed this one. So here is the next and very simple and very very important question, right? Next, very simple and very very important question. Yes, please do read the question completely till the end and try to give the best answer. Okay, so here is the simple question. That is a 45-year-old patient is diagnosed with a hypokalemia. What happened to the patient? Here is the patient is diagnosed with a hypokalemia, means there is decreased blood potassium level. Okay, and following a routine checkup, okay, so the doctor advised the patient to increase their potassium intake to help to correct the deficiency. Okay, there is the potassium deficiency, doctor advised the patient to improve the potassium, correct the potassium deficiency by improving the intake of the potassium. Okay, the patient advised to incorporate food rich in the potassium, okay, into their diet. Okay, so there is advice given to the patient to have the food which is rich in the potassium. Which of the following food is should the patient include in their diet to help to increase the potassium level? There is simple question. Okay, so the case of the hypokalemia is there, went to doctor told the patient to have the potassium rich diet. Okay, among these all given option, which one is the high potassium diet the examiner is asking here? So apples and white rice is a low potassium diet. Okay, so there is no use of the having the apples and white rice, because there is very less potassium is there. Okay, potato chips. Okay, so your bingo, the potato chips are rich in the sodium. Okay, rich in the sodium, which is not rich in the potassium. The spinach is the most important diet where there is a rich in the potassium, so we can recommend the spinach to the patients. Okay, so remember, these are the most important diet repeatedly asked in your exams, especially tomato, spinach, and this one argans. Okay, so that is the potato with skin is the most important. Okay, so here the potato chips are not a with skin, okay, which is rich in the sodium, okay. Potato with skin is rich in the potassium, okay. So these are the most importantly repeatedly asked questions, okay, especially bananas, okay. Along with this one there is a fluid we can give to the patient, that is the coconut water, okay. So coconut water rich in the potassium, okay. So it is rich in the potassium, very important, remember, okay. So hope it is clear to you people, right? So here is the again most important and very basic and important question for you people. Just do read the question, understand the question, and try to give the best answer, because like this one question I have solved to you people already. Yes, I have explained to you people already, like assertion and reason based questions. So do read the statements and try to give the best response. Yes, I'm waiting for your answers. A statement is telling, assertion is telling that delusion is the unshakable false fixed belief. Yes, already I have explained the delusion is the unshakable and which is the false fixed belief the patient is having. In the question number 1 only we have discussed those. This is the a true statement, okay. This is the true statement, means assertion is true here. Then comes to the reason, okay. So here the reason is telling that delusion are always caused by the hallucination. No. So there is no relationship between the delusion and hallucination. Hallucination is a problem of the perception. Okay. Here the delusion is the problem of the content of the thoughts. Okay. So yes, that is the delusion is different and hallucination is different. Delusion is a problem of the or disorder of the thought process. Okay. So here, sorry, the delusion is a disorder of the thought, and hallucination is a disorder of the, yes, the perception. So there is difference is there. So this particular statement is false, okay. Do identify the correct answer here now. Option A is telling that the both A and R are both A and R are true. No, the R is not true, so I'm eliminating the option A. Then comes to the option B, both A and R are true. No, R is false, so again I am eliminating the option B. So option C, A is true, yes, A is true, and R is false, yes, R is false. So option D goes to the option C goes to the correct answer here. There is the A is true but R is false. Hope it is clear to everyone. Okay. So here is the next most important and very important question. Very important question you people may face in your upcoming exams. Okay. So simple question. Here in the column A we are having the ECG changes, and in the column B, there is the electrolyte abnormalities are there. So just you people have to match the ECG changes with the electrolyte abnormalities and choose the answer. Yes, a peaked T wave will be seen in case of, yes, peak T wave will be seen in case of the increased potassium. Okay, so here is the hyperkalemia, right? So U wave prominent U wave is the classical sign seen in the hypokalemia, right? So here is the one more important trick you people have to remember, that is the QT wave is inversely proportional to the calcium. Means when the calcium increases, the QT becomes shorts. When the calcium decreases, the QT becomes prolonged. Okay, here the prolonged QT interval is there. So means the calcium is now low. Okay, that is the hypocalcemia, right? So the short QT interval is there. So that indicates the QT interval is short, means the indicating increased potassium level. Okay, so that is the calcium level. Okay, hope it is clear to you people. Then search for the answer. A is 2, then B is 1. A is 2, B is 1. Okay, anywhere like this. Yes, A is 2, B is 1. Then C is 3, D is 4. C is 3, D is 4. Here the C is 4, D is 3. No, it's not correct one. So option A goes again as a correct answer. Okay, so hope you people are clear about this question. This is how we people have to use the technique to solve the these kind of the questions in your exams. Okay, hope it is clear to you people. Then I am moving to the next question, that is the most important question. Here I am solving the very basic questions and repeatedly striking questions with a scenario based and all possible direction of the questions which comes in the exams on this one. Okay, so this is the very basic question, but the explanation of these questions will strikes in your exams, right? So I will do that one. So please do choose the correct answer in the comment box for this question. Okay, very easy question. Very easy question. Which of the following myocardial infarction marker rises first after the onset of the myocardial infarction? Okay, so simple question is the marker which rises first after the onset of the myocardial infarction. So here's the option A, troponin I. Troponin I is the most specific. This is the most specific marker for the myocardial infarction, that is the troponin I. Then creatinine kinase MB. Okay, there are CKMB, CKBB, CKMM is there. Okay, so CKMM, which increases when there is damage to the skeletal muscles. Okay, creatinine kinase BB, which increases when there is damage to the brain, and creatinine kinase MB, which increases when there is damage to the heart. Okay, so this one is the brain and this one is the skeletal muscles. Most importantly, there is creatinine kinase MB. It is also increases, but it is not first to increases. Okay, so my O globulin, or I am the first. My O globulin is the first. Remember like this. Okay, so myoglobulin is the first to rise. First to rise. Okay, so the scenario, this B type of the natriuretic peptide, or we can say the pro BNP. So this is a classical marker of the heart failure, not in myocardial infarction. Okay, so myocardial infarction we also call as a heart attack. Okay, so here the pro BNP or the B type of the natriuretic peptide, this is the classically seen in the heart failure, not in the heart attack. Okay, so hope it is clear to you people. Then there is a chance of arising the scenario based questions is there like this. Okay, so remember, first I will solve the all, I will highlight the all those very important points. The myoglobulin is the not specific to the heart, but it will early rises. Okay, the first rising one. Okay, so this one is the first rising one. Okay, so it will rises within 1 to 2 hours of the damage to the heart, and it will be peak for 6 to 8 hours, and duration is only for the 24 hours. Okay, consider a patient of the myocardial infarction who shown his first chest pain in the a local clinic in his area, and there they have advised the aspirin. After the 48 hours, a patient comes to the CABG unit or the coronary care unit, you can consider. Okay, so the patient comes to the now the coronary care unit after 48 hours. Then if you are checking the cardiac markers, which one you will neglect here? Yes, which one you will neglect here? बच्चों, after the 24 hours, the myoglobin you are unable to see there. Okay, but the patient came here as after 48 hours, means there is no use of the doing the myoglobin test after the 48 hours. Like this, the question may arise in the exams. Most importantly, the myoglobin is not specific, but the earliest to rise in the myocardial infarction. Okay, the peak will be 6 to 8 hours and duration will be 24 hours. Okay, till 48 hours it may seem, but after the patient coming 48 hours, there is only less to less chance to availability of the myoglobin in the blood. Most importantly, remember. Then the next one is the troponin I. There are two types of the troponin. One is troponin I, another one is troponin T. Okay, but the specific one to the heart is the there is the troponin I. So if the examiner is asking which one is the highly heart specific, if the examiner is asking, there is the troponin I is the highly heart specific, and there is chance of arising the scenario based question here. Okay, the patient comes to you at the 8 hours after the myocardial infarction, and which heart specific myocardial infarction marker you will identify here. Okay, the patient came to you 8 hours after, means a time to rise is the it rises within 4 to 6 hours, means when you will do the test at the 8 hours, so you will get the positive troponin I. But if the patient comes within 30 minutes of myocardial infarction and you are doing the test for the troponin I, means there may be a chance of the negative test, because it takes at least 4 to 6 hours to rise here. Okay, so the most important thing, then the peak time is the 12 to 24 hours, and it is duration will be yes till the 7 to 10 days. So we, if the patient is coming after 48 hours also, we are doing test also, the troponin I will come positive. Okay, so that's the most important and hard specific and best to for the identifying the myocardial infarction. Okay, then the CKMB will also rises at the 4 to 6 hour, and it will be peak at the 12 to 24 hours, but it will decreases within the 72 hours. Okay, this is the most important, and CKMB is the moderate to moderately hard specific, but not like a troponin. Troponin is the very important and highly hard specific is the troponin I. Okay, so then the pro BNP, or we can say the BNP is the okay heart failure. We can see this one in the heart failure. Okay, not in the MI. So hope your concept and all possible scenario type questions are clear to you people. Like this only the questions came in your UPSC ASSC exams, and previously there are 4 to 5 questions in every exams striking based on the peak time, rise time, and the patient arrival time, okay, associated with the specific markers of the our myocardial infarction. Hope it is clear to you people. And here is the very important next question, very and very easy questions. Okay, so the question is on the which of the following is a non-modifiable risk factor of the myocardial infarction. Okay, so there is chance of asking the questions by applying this question on the other also. There is chance of asking the questions like non-modifiable risk factor of the hypertension. Okay, so but disease conditions are different, but the concept is same here. Apply the concept what I am telling here, just the same thing apply in the exam, so you will get the marks. Okay, so the next very important question here is which of the following is the non-modifiable? It means we are unable to change the risk factor. So that is what you call as in the non-modifiable risk factor. There are two types of the risk factor. One is the modifiable, one is the non-modifiable. If we are able to change something, that is the modifiable risk factor. If we are unable to change the thing, that is the non-modifiable risk factor. Okay, so among these 4 options, which one is the non-modifiable risk factor for the myocardial infarction? Okay, so option A is the hypertension. Yes, can we able to change the hypertension? Yes, bacho. There are drugs, we can say the anti-hypertensive drugs. There is yoga, there is the relaxation technique. Okay, so there is non-pharmacological management, and pharmacological management is there for the increased blood pressure. We can apply that one, we can change that one. Okay, it is modifiable, it is not non-modifiable. Okay, so I am eliminating the option A. Okay, then comes to the option B, obesity. Okay, obesity, we can go for the exercises, gym. Okay, you can reduce the fat. Then most importantly, you can go for the yoga, aerobics, and walking, running, jogging, so you can reduce your obesity also. Okay, this is also modifiable. Okay, smoking, yes, you can go for the de-addiction center. Okay, you can take the medications, there is chance of the quitting of the smoking also there, so this is also modifiable. So but age is a non-modifiable risk factor. Okay, so once the age you get to the 35 to 40, so if your age is now 40, then try to take medicine and come back to 39. Is it possible? Take medication and go to 45. Is it possible? No, it's not possible. Means these are the non-modifiable risk factors. Listen, the look at the risk of list of the modifiable and non-modifiable risk factors. But the smoking we can leave. Yes, that is the modifiable. And hypertension we can control. There is the modifiable. Obesity we can control, modifiable. High cholesterol, that is the high cholesterol, or we can say the bad cholesterol, that is the LDL, that's controllable. Diabetes controllable. Physical activity modifiable or controllable. Excessive alcohol consumption modifiable or controllable. But age you can't change, you can't modify. Gender you can't change, can't modify. Family history, the history we can't change. History we can create, but history we can't change. Okay, so that is the reason. Okay, so whenever there is change of the syllabus in the system, all the syllabus will change, all syllabus updates will come, but history there is no updates, there is no changes. Okay, so when we were in our 10th class, there was change of the entire syllabus were there. So that time our like our teacher told like there is a chance of changing of the all the books are there, but history books remain same. So after the change the syllabus come, we see that there is the same thing is there in history. So who will change the history? No one can change the history. Okay, so here also the family history, if the patient is having the asthma, we can't go and change the history of the family, right? So that is what the history, family history goes under the non-modifiable risk factor. Okay, so then comes to the genetic predisposition. So if the genetic problem is there, that is also non-modifiable risk factors. Okay, so these are the list of the modifiable and non-modifiable risk factors most important for the exams. Okay, so here is the most important, one more very important question for you all. Okay, so that is, yes, the correct answer I want from you all, the very basic and important question: what is the correct formula to calculate the intelligence quotient, or you can say the IQ? What is the correct formula to calculate the IQ? Yes, option A is the IQ is equal to mental age into chronological age divided by physical age. No, this is not the correct answer. So I'm eliminating this one. Okay, IQ is simply, remember, mental age divided by the chronological age into 100. Okay, so this is the formula for the IQ. Search for this one, right? Option A, B, IQ is equal to mental age divided by the chronological age into 100. So this is the correct answer here. Option B goes to the correct answer. Remember, the ma divided by the ka is into 100. Okay, so that is the formula for the IQ. The very important. Always mother remains upside. Okay, so we can say the ma is the above. Okay, so the most important. Right, here is the next question, and very important question. The question is, which of the following is the IQ score corresponds to the severe level of the intellectual disabilities? Okay, in the severe level of the intellectual disability, okay, it belongs to the, okay, there is wrong option here, so just wait. It is not 40, it is 30. Okay, so here the most importantly, understand the gradings of the our intellectual disabilities, or we can say the mental retardation. Okay, so in the IQ score we have divided the mental retardation into the mild, moderate, severe and profound mental retardation. Okay, remember this one, these questions have came already in your mains exam also. Okay, in the mild intellectual okay, intellectual, so what we can say, intellectual disability. Okay, or we can say the mental retardation, the IQ is 50 to 70. Okay, so in the moderate or intellectual disability, IQ is 35 to 49. Okay, in the severe it is 20 to 34. Okay, in the profound which is below the 20. Okay, so all the thing what I have explained today is clear. And now the mental retardation, we will not call this one as in the mental retardation. So there is updated term, what we can say, that is the intellectual disability we will call for this one. Okay, so the correct answer for this one, the severe level of the intellectual defect means the answer will comes as a 30 as a correct answer. Okay, so hope this one is clear to you people. And what are the scenario based, match the following based, assertion reason based, and most important diet based, and mnemonic based questions what we have discussed today. Okay, the clinical based questions on the Somagi and Down phenomena, everything is helpful to you people. Okay, if the content found helpful, and if you content found the quality, so please hit the like button, subscribe button. And if anyone of you want to enroll to the our test series, the best India's most updated, most quality, most preferred test series for the upcoming Norcet 9 exam, that is the Norcet 9 Navagraha plan. Believe me, bacho, the questions will not goes out of this box of the Norcet 9 Navagraha test series plan, because which is created by the, preferred by the expert AIMS nursing officers team. So if you want to become a part of this one, so please download the Master Nursing Classes app. We have given the link in the description box, and that I hope you people enjoyed the today's class. Okay, so in the tomorrow's also we'll come up with a very important differentiating class like cataplexy, catalepsy, Somogi effect, okay, down phenomena. Okay, so how to differentiate, how to remember with clear explanation, I will come in front of you people. So tab tak ke liye stay connected, stay motivated, keep preparing. Okay, all is well. So Remember, the comeback story should be strong. The setback, what we can say, the comeback story should be stronger than the or the greater than the setback. Okay, so no negative can pull you down. Okay, when you will be connected with the master nursing classes. Okay, so stay connected, stay motivated, stay positive, and keep studying. Love you all. Bye bye. Jai Hind, Jai Bharat.